Hi class, my name is Leslie T and I'm doing my presentation on MDMA, which is 3,4-methylene dioxymethamphetamine. What is MDMA? MDMA is popularly known as ecstasy. It is a stimulant. More specifically, it is the most popular Schedule I designer methamphetamine. MDMA used to be more popular in clubs and raves back in the day, but now it is used by a broader range of people. MDMA is popular in young adults and college students, possibly due to parties and raves. It can be taken as a capsule, liquid, powder, or as in this picture, a tablet. It is also known as Molly, which is slang for molecular, and it refers to what is supposed to be pure crystalline powder form of MDMA, but oftentimes Molly contains other drugs that are dangerous when it is mixed. MDMA, just as any drug, affects people differently, and it depends on one's size, weight, health, if the person is used to taking it, and if they've mixed it with other drugs, also the amount of drug they've taken and the strength of it. MDMA produces various effects on a person's body, including increased energy, pleasure. MDMA is an empathogen, which means that it increases an individual's feeling of empathy and compassion towards others. It also increases emotional warmth. It distorts sensory and time perception, increases one's heart rate, blood pressure, and produces chills and excessive sweating. High doses of MDMA can cause psychosis or paranoia. MDMA's effects lasts about 3 to 6 hours, and many people take their second dose as the effects of the first dose fades away. There are many risks and consequences when taking MDMA. Such as mentioned before, it is dangerous when people take Molly, and there are other drugs that are especially dangerous when mixed with Molly. Repeated use of MDMA may include memory and attention problems, depression, decreased appetite, irritability, withdrawals, impulsiveness, anxiety, decreased interest and pleasure from sex, colds or flu, and financial, work, and social problems. Possible symptoms of MDMA withdrawals include aches and pains, exhaustion, agitation, and restless sleep. It has been debated whether MDMA has addictive properties due to MDMA users also using other drugs, and so it is difficult to determine whether the dependence is solely due to the MDMA. The potential to cause addiction by MDMA is somewhere between an amphetamine and LSD. Other important information. Ecstasy pills are very dangerous because they may have a small amount of MDMA or actually none at all. Just like any other drug, there is no safe level of use, and mixing it with other drugs or alcohol will heighten the risks and consequences. Too much MDMA can cause a dangerous increase in body temperature, which can be fatal in some environments. In 2014, the National Survey on Drug Use and Health found that more than 17 million persons 12 years old or older have reported using MDMA at least once in their lifetimes, which is an increase from 11 million reported 10 years prior. As we can see, more people are using MDMA. Treatment for MDMA use disorders include cognitive behavioral interventions, which are designed to help modify the patient's thinking, expectancies, behaviors, and how to increase their skills in coping with life's stressors. Here are the sources I used to compile the information for this presentation. Thank you for taking your time to watch my video, and hope you stay healthy and happy.